Hello again and welcome to my YouTube channel. Today I'm going to be talking to you about mental illness in African American children and teenagers. My name is Tracy Maxfield. I'm a retired nurse, peer specialist, author, and a very staunch stop bullying and mental health advocate and educator. So February is a very important month because it's actually African American History Month, or Black History Month, as they call it in the United Kingdom. And it's a month where we take time and we recognize not only the African American people, but also their culture, their history, literature, and their contribution to the world in general. Now, what we've learned from earlier blog posts and YouTube channels is that mental illness does not discriminate. Anyone, any age, any color, any race, ethnicity, gender, socioeconomic status, religion, doesn't matter. Anyone at any time can have a mental illness or mental disorder. Now, sadly, what we have found is that the minority groups, such as the African Americans, Hispanics, Native Americans, and Alaskan Natives, and Asian Americans, just to name a few, usually experience much more severe forms of mental health problems. And what they are finding is this is due not only to their cultural influence and unmet needs, but also racism plays a significant role, as does socioeconomic disparities. Now, in the United States, it's anticipated that 13.2% or 42 million are actually identified as African American. And last year they determined that of these 42 million, approximately 16% of them, and this is children, teenagers, young adults, had a diagnosable mental illness or disorder. Unfortunately, only 1 in 3 actually received appropriate care and treatment. And what we've actually found is that African American children and teenagers seem to suffer the most. They have higher rates of OCD, obsessive compulsive disorder, depression, and conduct disorder than Caucasian children and teenagers. Sadly, the majority of African American kids do not actually seek treatment or even tell a trusted adult what's going on with them due to stigma and the community's misunderstanding of mental illness and disorder. I'm going to go into detail about that a little bit later. But consequently, what we have found is that the suicide rate amongst children ages 5 to 11 has actually increased significantly in African American children. This is suicide 5 to 11, think about that. And youth suicide rates since 1991 has increased 73%. That is absolutely horrendous. So we know that brain growth and development is influenced by genetics, early environment, that is in utero, and the current environment. And the risk factors for a child or teenager developing a mental illness or disorder can include family history, traumatic brain injury, bullying, family history of mental illness and suicide, and ACEs. And remember, ACEs, adverse childhood experiences, such as abuse, maltreatment, neglect. Children and teenagers from impoverished, homeless, incarcerated, and or substance abuse families are at a significantly higher risk for mental illness. And this is one of the factors why minority children have more mental health problems and are predisposed to developing suicide ideation and mental disorder. So I'm going to give you some facts first before I go into some of the challenges that mental illness in African American children have. So some facts. Let's, as I read them out, think about ACEs and the environment that African American children are actually born into and exposed to. So drug use in African American children and teenagers is slightly higher compared to the national average. 1 out of every 2 African American children and teenagers live in poverty, compared to 1 in 7 in Caucasian families. African American children are 10 times more likely to die by gun violence, and approximately 30% of African American households only have one parent that is usually female, compared to 9% of Caucasian households. 11% of African Americans do not have health insurance. 25% of African American youth exposed to violence have proven to be at higher risk for PTSD, and this was actually a study conducted by the US Surgeon General. 40% of African American youth are in the criminal justice system, and 45% of African American children are in foster care. ACEs. So if we go back to a very, very charismatic and influential leader in African American history, we think of Martin Luther King. Now, on August 28, 1963, Martin Luther King Jr. delivered his iconic speech, "I Have a Dream." It is extremely long, and I'm not going to read it all out here, but some key factors was: he spoke of lifting the nation from the quicksands of racial injustice, that all men are created equal, and that my 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. Now, certainly since then, I feel that we have progressed and we have come a long way, but it seems in recent years, we've taken a step backward. And once again, inequality and racism and segregation, especially of all minority populations, has become a reality, and this is not good. So, going back to African American culture, I think some of the challenges when we actually deal with mental illness, especially in children and teenagers, is that there is an intricate connection between the socioeconomic, political situation of the day. And what we have found is that, especially in African American children, we have poverty, we have drug use, we have homelessness, we have lack of education, we have inequities in what they can access, not only in life and in the workplace, but also in healthcare. And these inequities that impact not only the children and teenagers, but primarily their families, will have an effect. So if we have a single parent household where mom is working 2 jobs, and it's not such a nice neighborhood, and the kids are exposed to all sorts, plus they're not getting equal and fair treatment in the community or in the school system, all of these the kids' brains are being exposed to, and this is creating problems. So if we think about what some of the issues are with regards to mental illness, the first challenge we have is that there is a great misunderstanding about mental illness in the African American community. There's a huge stigma attached to it, and many people actually feel that the illness is a punishment brought on by God, or else it's seen as a personal weakness. Now, this leads to feelings of shame and hopelessness, but this misunderstanding actually only perpetuates the stigma associated with mental illness. Now, what research has shown us is that African American kids actually express emotional distress quite differently than other cultures, especially Caucasian kids. And this has resulted in many kids being misdiagnosed. For example, African American kids and young adults are diagnosed with schizophrenia at a significantly higher rate than any other minority group. And it's actually misdiagnosis, because these kids are actually experiencing symptoms of PTSD, bipolar disorder, or depression. But because they don't express their emotions and show what they're going through, as maybe I would, it's misinterpreted. And it's this lack of understanding of this staunch resilience and strength, and the lack of expressive emotion that has led many psychiatrists misdiagnosing them that they obviously have a schizophrenia, when in fact they have a bipolar disorder or a depression. And because of that, they're not treated appropriately. So that in itself becomes a problem. Also, what we know is that African Americans typically have preset beliefs related to stigma, psychological openness, and help seeking. So research has shown that African American communities actually believe that mild depression or anxiety would be considered crazy in their community, and that actually prevents them not only from talking to others but from seeking medical help, even if it's needed. The majority of African Americans prefer to use complementary therapies to treat whatever ailments they have. And this is not only medical and physical, but also emotional. So for example, if they're anxious or have extreme stress or depression, prayer would be the go-to therapy that they would use. Other remedies, other home remedies, and holy oil is also being used to treat feelings of sadness associated with depression and anxiety and fatigue. Now, I'm a huge advocate for complementary therapies in helping someone who has a mental disorder. I believe the holistic approach is key. But if you have a child or a teenager who has a major depressive disorder, prayer and holy water or holy oil is not going to be helpful. They really need to have a proper assessment and then counseling, and they may also need medication. Another problem is that faith and spirituality and that sense of community is a huge factor in African American cultures. That's why we find that they tend to live together in communities with very few Caucasian people living there. And it's a great strength of faith and support, definitely. But relying on one another to give you that emotional support is going to be helpful only in a small degree. You still need to have that medical intervention. So that's another challenge. Inequality to care is huge. And so I think because there is such inequality of care, especially on marginalized groups, that they don't have access to health insurance and even access to services. And when they do access services, then there's either racism or stigma attached to that, so they have poorer health outcomes. And sadly, African Americans seem to bear the brunt of the healthcare challenges. To further compound the issue, what we do know is that wealth in the USA is also unequally distributed by race, especially between African Americans and Caucasians. Now, I don't want you to interpret what I'm talking about as blaming Caucasians or the government or anything, but what I'm trying to point out is because of the reality of what these kids and families are facing today, it has a significant impact on not only their economic status but on their health and well-being. And these disadvantages are actually thrusting these kids to look for other opportunities or to gravitate more towards gangs or crime or drug use as a means of coping with what's going on. If they have an OCD or an anxiety disorder, bipolar and no one is listening to them, or they're trying to tell someone and they're not being adequately treated or being misdiagnosed, you can see why they actually go in another direction, which may not be conducive to recovery. I think another thing attached to the inequality of care is the reluctance and the inability to access mental health services, and contributory factors include distrust of the healthcare system, residential segregation, lack of insurance, and this is a big one, lack of culturally competent providers who are African American. If an African American child or teenager has depression and goes to a Caucasian psychiatrist who has never had depression or even has had depression, that person really, unless they've had cultural competency training, which I understand we do in Canada, but not so much in the United States, if they don't have that inner awareness of the culture and the history and the challenges that the African American community experience day to day, and this is based on centuries. Remember, we have to go back to centuries of mistreatment, which began with slavery, and segregation in schools and in washrooms and in stores and on the bus, Rosa Parks, right? This is all part of their identity, and they bring this with them to the table. And if you are not culturally sensitive and educated, you are not going to get anywhere helping African American children and teenagers. Hence the lack of trust and the unwillingness to be open and to follow through on maybe even treatment options. And of course, I've introduced it, so I have to talk about racism. I'm sorry, people, it is globally everywhere, but in America lately, racism significantly with African Americans, and now actually with the Jewish population, has reared its ugly head again. I'm going to read this because it's a long word. A short time ago, a study was published in the Journal of Psychoneuroendocrinology, and it found that racist experiences bring on an increase in inflammation in the brains, especially in those of African Americans. Now, as I mentioned earlier, in earlier blogs, we know that inflammation in the brain and body not only increases the risk of chronic illness, but also of developing a mental illness and disorder, especially because the child or teenager has the whole body experience of inflammation from head to toe. Now, other studies actually support this hypothesis and found that life stressors related to racism, poverty, crime, inequality resulted in repeated exposure to toxic stress and increased inflammation in the brain-body pathway. And if you want a refresher course on that, please refer to YouTube video and blog post 1 and 2, where I go into the basics. So I think what I'm trying to show you is that diagnosing, identifying, and appropriately treating mental disorders in children and teenagers who are African American is very complex and multifaceted. We really need to have an innate understanding of how they express their emotional needs, their responses to it, the types of help that will propel them towards recovery, what supports they're willing to accept. And certainly we know that there has to be changes to healthcare and government policies, not only from the government level, but from the local level. And we need to have the ongoing input of the African American people to influence the change as to what is appropriate for them. Similarly, we've seen that with Native American and Alaskan Natives, that their way of treating a mental illness is very different, and the types of supports they need is more holistic and spiritual. Well, the same is true of any minority group, but especially with African Americans, given the dense population in the United States. And so I think that for change to be effective and for African American kids to be helped, we need to have an understanding and awareness of the historical trauma, their religion, their culture. It is key. And there is no one quick fix solution. This is going to take time, but it is implementing counselors and physicians and psychiatrists, dietitians who have that insight and knowledge that they can work with the African American community. For Caucasians, we definitely need to have more cultural competence and education in order to work with and support African American people, especially children and teenagers. So I hope that you found this little delve into African American history and the impact on how they perceive mental illness and disorder. In my next blog post and YouTube video, I'm going to talk about a very controversial subject right now, the use of cannabinoids or CBD in the treatment of mental illness in children and teenagers. So I hope you'll join me then.